The theatre is at the foot of Mount Kilimanjaro. Michael Wood, Tom Rees, and Archibald Macklindo are the main actors in this play. The thespians desire to inspire the why of life. In 1957, the Agency of Saving Lives Through Flight in rural Africa was born. The Flying Doctors of East Africa started working from Wilson Airport in Nairobi, combating the effects of poverty, tropical disease, and lack of adequate health service. Using their little Cessna aircraft, they took medicine and healthcare to the most remote parts of the region, where the people had no access to doctors and health facilities, with the rough terrain and often impassable roads making access to medical care even more difficult. As this was where the majority of the population lived, the doctors saw an air-based service as the only way to get healthcare to remote communities. That first charity flight laid the foundation for what is today Africa's leading international health development organization.
The development of Amref has been based or premised on the needs of the continent more than anything else. So whatever the various countries of Africa need is what Amref responds to. Amref has developed programs that deal with mothers' health, with children's health, programs in HIV and AIDS and malaria, programs in water and sanitation, programs in research, programs in training of health workers. We have continued to do research because research is very important. It is research that gives us evidence to prove that what Amref is doing is relevant and it is providing what needs to be provided.
Currently, we support more than 160 peripheral hospitals to provide specialized medical services in hard-to-reach areas. Furthermore, using our experience and our knowledge, we gather evidence to advocate for practice and policy change.
Our founders were surgeons, and they came to East Africa after the Second World War. And when they came, they were looking at how can they use their services as surgeons to provide health services to communities, remote communities in East Africa. So the tool of their time was the aeroplane. Since then, Amref has been looking at these tools of our time and asking ourselves, how can we use these new tools to solve the health challenges, to solve the development challenges? We have evolved from using aeroplanes to using HF radio, to using radio, Dr. Amref, to using telemedicine, and then to computers and to mobile devices, including mobile phones and tablets. Today we use mobile phones because mobile phones have become very pervasive. We use tablets to provide health information, to collect data from communities so that this data can be used to make better decisions based on real issues that are in communities in Africa. We are using mobile tablets also to provide community health workers with training so that they can be able to link up the communities where they serve to health facilities.
There are many achievements of Amref, but the major achievement that I see for Amref is being able to transform our communities to become their own agents of health. Transforming communities in a way that after Amref or anybody else leaves, those communities can take on and become their providers of basic health. And that is from our vision, the Amref vision, that says we transform communities from within.
Amref is rebranding because our name doesn't represent anymore what we do. When we started Amref in 1957, Amref used to provide medical services and we used to do operational research in the field. Now Amref has changed into an African international organization providing health development to African communities. The scope of our work has changed. We have now rebranded to Amref Health Africa.
Amref Health Africa, bringing lasting health change in Africa.